My name is Caryl Hale. I am the Executive Director at Norton Regional Health Foundation. With the Blue Cross and Blue Shield Pathways grant work, with the community health needs assessments, and with some of the surveys that we took early on with this Pathways work, we realized that we had a significant a potential partner that was sort of unseen in our community. This partner is the Norton Correctional Facility. We were exploring community engagement using art, and that started with a separate project with the Arts Council with a skate park project, but then it started this idea that maybe we could use this idea of community engagement and murals and work with the correctional facility. We started collaborating and working on a grant proposal for not only the Blue Cross and Blue Shield Pathways implementation grant for placemaking, but also an innovative partnership grant with the Kansas Arts Commission to bring in an artist, a community-based artist by the name of Dave Lowenstein out of Lawrence, Kansas. The mural project is 2 murals. One is at the Haven, which is here in town, and the other mural is at the medium security chow hall. And this is where all of the residents go for 3 meals a day. As far as visibility and access goes, we wanted to make sure that whatever we were creating was accessible to all of the residents and not just some versus the others. And then we also do this during a time when the rest of the residents come in for lunch. You know, as they're coming in to get their meal, they're sitting down and they're watching us, and you can hear the dialogue about what the imagery means and where, what their thoughts are on it. And then the same with the Haven, we worked with a team of community members to start at that mural project. So these 2 murals were going on at the same time. And during this time where we were exploring this placemaking mural project, we were also conducting a local food study. We invited the warden to weigh in on this because the correctional facility, it kind of operates as its own complete environment where, they grow their own produce. We kind of came to the end of the food assessment and realized, wow, we have some significant needs in our local food system as far as accessibility goes. And we don't have a lot of growers, but we do have this partner who their challenge is they grow so much produce. They grow like 55,000 pounds of produce a year and have some of that go to waste. They need a place for this. That kind of led to another project that we're currently working on. We applied for a USDA grant to conduct a feasibility study with our with New Venture Advisors, who also conducted our local food assessment. And right now we're looking at how to work with the correctional facility and their needs as far as education and skill force development or workforce development for the residents at the facility, then look at using that excess produce to then supply the county hospital and the local school districts and possibly other institutional food system partners. I think sometimes nonprofits or small communities especially can look at something like a state correctional facility as it can be really hard and cumbersome, and there's this idea of a lot of red tape. And I'm not saying that there's not, but I think we've realized that you got to start with that first conversation and really learning about each other and trying to navigate, just that conversation kind of opens the door to all kinds of possibilities. Our next phase in the feasibility study for this food system work is to then provide a blueprint for other communities that have a correctional facility across the state to look at how they can kind of close that food system gap using the resources that are available to them, because this was a resource that was completely untapped in our community. This has just kind of opened up all kinds of possibilities for us.